Immune thrombocytopenic purpura.
Immune thrombocytopenic purpura, or ITP, is a blood disorder characterized by decrease in the number of platelets in the blood. This disease is caused by an immune reaction against one's own platelets. It has also been called autoimmune thrombocytopenic purpura. ITP can be of two types, acute and chronic. The acute ITP usually affects young children aged 2 to 6 years. The symptoms of ITP may follow a viral illness such as chickenpox. Acute ITP usually starts suddenly, and the symptoms usually disappear in less than 6 months or often within a few weeks. In this case, treatment is often not needed, and this disorder usually doesn't recur. The chronic ITP can happen at any age, and the symptoms can last a minimum of 6 months to several years or a lifetime. Adults are more affected than the children, and in females, it is more common than in males. Chronic ITP can recur often and require continual follow up care. Causes of ITP. In ITP, the immune system is stimulated to attack one's own platelets. Most often, it is a result of antibody production against platelets. But in small number of cases, the T lymphocytes will directly attack the platelets. ITP can occur in many conditions. For example, in patients who are on certain medications like cephalosporins, penicillin, ethambutol, etc., there is development of antibodies which cross reacts with platelets. In infections like viral infections, chickenpox, hepatitis C, and AIDS, the antibodies can develop which can cross react with platelets. ITP can also be seen in pregnant females or in disorders like rheumatoid arthritis and lupus. Patients who are having low grade lymphomas and leukemias may produce abnormal antibodies against platelet proteins. And sometimes the cause of ITP is unknown. Symptoms and signs of ITP. Patients with ITP may have bruises from no known injury. Large bruises can appear at the joints of elbows and knees just from movement. Tiny red dots under the skin, which are also known as petechiae, can result because of very small bleeds. Patients can have nosebleeds, bleeding in the mouth or in and around the gums, heavy menstrual periods, blood in the vomit, urine, or stool, and intracerebral bleeding. The diagnosis of ITP requires complete blood counts, which shows platelet less than 1.0 lakh per microliter in patients with ITP. The bleeding time is increased, and antiplatelet antibody test can show presence of antiplatelet antibody. Initially, the bone marrow aspiration was always required to confirm the diagnosis of ITP. However, nowadays, if the antiplatelet antibody test is negative, then the bone marrow aspirate is done for confirmation of the diagnosis of ITP. In the bone marrow aspirate, in cases of ITP, there will be increased number of megakaryocytes. Wherever the treatment is necessary, the most common forms of immediate treatment for ITP are steroids and IV immunoglobulins. Other treatment options are change the medication if the drug is causing ITP. If there is an underlying infection, the treatment should be treated. Splenectomy is done in some cases as it is the most active site of antibody mediated platelet destruction. So, in patients who have chronic ITP, to decrease the rate of platelet destruction, splenectomy can be done. Platelet transfusions are given to patients with severe bleeding or those patients who are about to go into surgery. Rituximab is a medication which slows the antiplatelet antibody production. Also, romiplastim can be given if there is failure of all type of treatments, as romiplastim stimulate the bone marrow to produce more platelets.